Hello and a very good afternoon to all of those who are joining me live on the Facebook page of News 9. I'm Neha. Now, if at all you've recovered from COVID-19, you shouldn't be celebrating just yet. Ask me why? Well, this is why we're here to discuss this particular piece of information that has now come to light. The COVID-19 pandemic has created havoc across the world. People are suffering because of the complex nature of the virus, and with vaccine a distant dream, it does appear the only way to deal with the virus as of now is to take all the preventive measures. While the pandemic has created, widespread havoc, what comes as a hope is that there are many people who have recovered from the highly contagious disease. Although that is the case, but the question is, how much time does it really take for COVID-19 patients to clear the virus? Yes, the term here is clear the virus. According to research published in the British Medical Journal, it's being said that it might take a month for a COVID positive patient to clear the virus. The study suggests that 1 in 5 negative test results can be false. The study by doctors was conducted on close to 1,162 patients using a polymerase chain reaction. The doctors put forth some information suggesting that about 1 in 5 negative tests are false negatives. 60.6% of the patients tested negative in their first follow-up. Out of the 78.7% of the patients who tested negative, 1 in 5 of them were false negatives, which means that these people still are affecting others unknowingly. While it took a little longer for people who are comorbid or are older to clear the virus, the study suggested that it took around a month for a COVID positive patient to clear the virus after testing negative on 2 consecutive PCR tests. Now, to speak more on this, I've been joined by Dr. Vivekanand, who's a public health researcher from the George Institute for Global Health. Thank you so very much, Doctor, for taking out some time and speaking to us. We understand you're really very busy. So, the first point that I would like to discuss with you, in fact, I'd like you to enlighten us as to how much time does it actually take for any patient who tested negative to clear the virus, and how long the virus really stay in our system.
Thank you for inviting me to speak with you and your audience. Now, you ask a very difficult question. Information about the coronavirus has been evolving for the last several months. And almost on a daily basis, we are learning something new. The biological behavior of this virus remains a bit mysterious. Some of it is because we don't fully understand its normal reproductive or life cycle. Second is our test methods are not as good as they need to be. So, as you said, some of the tests could actually be false negative, which means that the virus was actually there, but the test did not pick it up because the sensitivity was not good enough. In which case, it's just that we need better tests. That's number one. The second is that the persistence of virus really depends on the behavior of the virus and the behavior of the human immune system as well. So in some people, the virus can escape immunity because it stays in some such niche area where the immune cells are not able to reach. For example, in saliva or in the nasal mucosa, etc., where the immune system is not able to reach and therefore not able to clear the virus. That's number one. Number two, some people don't generate enough antibody, and therefore, the amount of antibody that is needed to clear the virus is not enough in these individuals. In third situation, you could have really someone who became actually negative or cleared the virus, but got reinfected or the virus got reactivated. That's also possible. These kind of things have been described. Then finally, there are some people who shed the virus only intermittently. That means that they don't, let the virus loose into the various secretions from where we get this virus through either RT-PCR or through antigen tests on a regular basis. Right. So these are the various reasons why we could have a negative test and then it could come back as positive.
Right. So, Doctor, the study also suggests that 1 in 5 negative test results can be false, which means the people who are negative are actually positive and, they are unknowingly affecting others as well. What can be done to address this issue?
Well, that really indeed is a public health issue, not only an issue for that individual, because that individual most likely has become asymptomatic or was asymptomatic all the way through. But they could still be shedding the virus and infecting others. That's really a very good point. What we need is just better tests, and to realize that just because a person has become negative after, say, 2 weeks or 10 days, doesn't mean that the person is now free to go about and mix and mingle like they are truly negative. So they need to still continue to maintain the appropriate precautions. For example, wear a mask, maintain social distancing, wash hands, and observe the kind of other precautions that we all know about very much by now.
Right. So, Doctor, while this was one study, there is another study that has been conducted in Korea, where it's being said that the COVID-19 patients who have, tested positive can really not infect others after they recover. So, the question is that are the people who have recovered from the virus capable of infecting others? And if it is so, is it a dead virus?
Yeah, frankly, we don't know the correct answer to that question. And this is something that tells us that there are different strokes for different people. So in a vast majority of cases, we do know that people who are infected will infect others, whereas in some other instances, it is possible that people who are positive really have a very, very low viral load. So they are not able to really transmit it in significant amount, or that the virus that is being captured is non-pathogenic at that particular point of time, so that it doesn't go to others and cause a serious illness. So that's something which we are still figuring out. I think we'll require more research to be able to differentiate between these various features.
In fact, I'd like to just beg your pardon, because it was not the people who had tested positive. It is after a person who has tested positive. If he again tests positive, he's really not able to, he will not be infecting others. That's what the study in Korea suggests. But Doctor, lastly,
Correct.
I'd like to ask you.
It's like, yeah, I was just going to say that it is most likely the situation that these people have a very low viral load, and therefore they don't have sufficient viral load to be able to transmit it to others. That's the most likely explanation.
Right. So, Doctor, the last point that I'd like to discuss with you is that what do we really know about coronavirus so far?
Well, what do we know about coronavirus? That will take a long time for us to discuss. We know that it's a raging pandemic. It's highly infective still. We know that we are learning a lot about the biology. We know that we need to do more clinical trials in order to be able to identify safe and effective interventions that will allow us to help patients who have this infection. We know that it is infecting a large number of healthcare workers, and we need to find appropriate strategies to protect our healthcare workers. We also know that people with COVID really might suffer long-term consequences related to various organ systems, such as the heart, the lungs, and the kidneys. So these people will need to be followed up for very long periods of time. It is not like a common flu infection, which you have for a short period of time and then you have recovered fully. We know that we need to understand the biology of this virus a lot more in order to be able to develop appropriate methods to deal with this. We are developing vaccines, but how effective those vaccines will be, will people develop reinfections? Will there be mutation in the virus which will cause the first generation of vaccines to remain effective or not remain effective in future waves of this infection? All of these things are unknown. So we know relatively little. We are knowing more and more almost on a weekly basis. But I think it's really very important that the scientists and the people who discuss this information are able to clearly separate out authentic, well-tested information from a lot of what has been called infodemic by the WHO that has been going around and spreading through social media and other such tools.
Right. Thank you so very much, Doctor, for talking to us and taking out some time. But for all of those who are wondering that we've recovered from COVID-19, there's nothing really that we should be worried about. This should ring the alarm bell. Please try to stay at home as much as possible. Thank you very much for joining me. Stay safe. Take care of yourself. I'll see you next time.